Hi friends, Dr. Ryan here. I want to share you one case study on bedwetting, or which is also called as nocturnal enuresis. This is the case study of a boy who was in high school studying in 10th standard, and as the days goes on, parents could observe that the their child is not doing good in studies, not even participating in social activities, not even interacting with friends, and denial to go to school. And whenever parents want to discuss anything, he becomes aggressive. And parents could see that he's stressed and he's very dull, not even sharing, not even talking with them. And he looks very dull even at home. And they could see that even for simple reason he started fighting. So his aggressive behavior, fighting, his dullness, all things were mixed. So initially they don't know what to do and they could not understand what is the issue. So then what they decided is that they have to do something for their child. They have to really help their child to come out from the problem. So with this, what they actually do is they thought they have to go to a counselor, they have to meet a counselor, so that what happens, at least they can find a proper solution for the problem. Here, when parents discuss with counselor, they came to know that there is an issue, the child is having some behavioral problems, the child is having some behavioral issues and all, and the counselor could identify that the child is undergoing some stress. But since he was discussing with parents initially, he could not see what exactly the thing, but the counselor could understand that the child is undergoing some problem, some serious problem, which he wants to express, which he want to come out. And these all the behavior what he is exhibiting in family is because of that. And counselors identify the problem and explain the problems to parents, and for further reference refer to them to a psychiatric doctor. See friends, what I want to really tell you is that once the problem has been identified and once they come to know that the problem has to be dealt in a very systematized way, so here what counselor does is that counselor informs the parents that it has to be properly referred, further investigation is required, proper information is required. So what happened, the counselor refers the case to psychiatric doctor or psychiatrist. So what happened here, as the psychiatric doctor consults, when the psychiatric doctors comes to know and when the deep diagnosis is going on, they will come to know that it is a case of depression. Now dear friends, one thing we all should know clear, that whether the child will get depression, child who's studying in high school will get depression. Yes, the child will get depression based on the situation, based on the need, based on the problem. We should see the circumstances the child is undergoing. So here also, in this case also, the similar things happens where the doctors comes to know that with all the problems what I explained you initially, doctors comes to know that this is a case of depression. Doctors diagnose it as a depression. But what happens here is that once the diagnosis is done, you cannot allow the person to go home because the person can do anything, any problems can happen. So doctors here, doctors just tell the parents that the child has to be admitted in the hospital for the further investigation, so that the doctors can take a detailed case history. So here what happens is that in this case particularly, during his stay in the hospital, psychiatric doctor will have a detailed discussion, as I mentioned you already, which is we also called it as a case history. And through the discussion, doctor came to know that yes, it is a very small, his family is a very small family, or we also call it as a nuclear family. They live in a village. Till high school he can study. For the college education, he needs to live in cities or he has to go out. He was good in studies. Now dear friends, when you read this, you might be also confused what I'm trying to tell you. So here you will come to know that this is the initial discussion what he had with the doctor, saying that this is his problem. Like when they are taking case history, he is telling that this is a situation only till high school. I can study here, and for my college studies I have to go out, And I think that itself was irritating him a lot. That itself was creating a disturbance in him. As the case goes on, the client or the child will explain his real problem. And here now he reveals his problem. The problem is bedwetting issue. Dear friends, I told you initially he is in high school studying in 10th standard, and you know that in the 10th standard every child has to face SSLC exam, and after SSLC exam they have to select a course for PU. And what happens is that in some villages we know that we have PU education, but in some villages they don't have PU education at all. So but the problem was what here is that since he used to wet his bed even this age, he didn't know what to do. Because if we go and stay in the hostel, the same problem will continue, where he has to face again the issue. If we stay in his relative's house, again the same problem. And he know that if the people observe him with this problem at this age, they will surely tease him. They will really make his life a big mess. So he has to face a lot of problem. And here I also mentioned one point where family members used to tease him. This was making him more stress. And here in this point of view, what has happened is that even his own family members were unable to understand this as a problem. This as a real physical issue which is really creating a mental torture for him. So what happened is that since he was revealing his problem to the doctor, now he has really shared his real problem for what he was really depressed. Or in other way, what I can tell you is that here you might have come to know exactly why initially they have diagnosed it's a depression. The main reason maybe their diagnosis is a depression, but here friends you will come to the main reason is bedwetting. So here, after sharing his problem with doctor, he feels happy and relaxed, and the same was explained to his parents and educating them how they need to handle this issue. So friends, here what happened once the problem was shared, once the child shares his problem, I think he feels relaxed. For anybody that matter, when the problem is shared, when there are people to listen to your problem, one or the other way, even you feel relaxed. Even the same thing happened here. The child was relaxed, but it is not the end. Because the child is relaxed, it is not the end. There is lot thing which has to be done, or which has to be where the parents has to really interfere so that they can create a sustainable, or what I can say, a very good environment for his child. So here, dear friends, I think this is, I've already mentioned that what the problem the boy was suffering, and you all know that at the age of 5, the bedwetting problem, if any child is facing this bedwetting problem at the age of 5, it is achieved. Or you also know that there are proper way where you give a proper toilet training to your kids or children so that they achieve this issue. But what happened? If after that the problem continues, even if after that the child is not able to control, then the problem occurs, then the issue occurs. And you know friends, believe it or not, even in the case also the child was suffering like anything. And especially when he came to know that I'm going to finish my education, after this I have to go out, I have to study and all, this has really created a very stressful environment for him. Again, friends, if anybody is suffering from this issue, so I have mentioned here what they're supposed to do, and what you are as a parent, what you're supposed to do, and as a kid, what he's supposed to do. See here, after 6 o'clock, do not take tea, coffee, or any liquid food and less water. This is very important, friends. And one more thing, it is better to wake up the child in midnight to urinate. Parents should really support in this cause, because here parents take, or parents has to take a big responsibility to help their child to come out from the problem. So these few things I want to inform to parents, that child is helpless in this matter. I think it is very clear. Child is not doing it purposefully, because child has to undergo this pressure. And it's not that purposefully child is doing that. There are a lot of issues which is undergoing, a lot of pressure which he is undergoing, and he cannot control his urine. He cannot control his urine. Do not compare with other children. This is the biggest mistake as a parent sometimes we do, that if any issue, any matter, nowadays with the talents, skills, techniques, marks, we always compare our child with other children, and we always tell them that you compete with him, you compete with her. No, this problem is a very individualistic problem your child is facing, because maybe for other children they might have achieved their toilet or training, or they might achieve this problem of bedwetting in a very young age. So they may not be facing the same problem, but your child is facing same problem. There might be some physical issues in his body where he is unable to control his urine, or there might be some mental issues, because of that he is unable to control his urine. There might be some other issues and all which has to be identified in a proper way. And again, I told you the same thing, child is not doing this purposefully. There is a reason behind that. Do not discuss the problem in front of your relatives, please, dear parents. Even I know that you want a proper solution for the problem. If you want a proper solution for the problem, you should meet a proper person in front of everybody. If you discuss is a problem, that itself create more stress on your kid. That will create that feeling is called as very embarrassed feeling, where a child has to undergo, needs constant attention and appreciation. You need to give proper attention, proper concentration, and whenever the child is doing something good, you need to really appreciate. Dear friends, when it comes to treatment, I have mentioned 3 points here: counseling and guidance, medicine, and follow up. Why counseling and guidance is very important? Because when you talk to a counselor, he will give you proper information on how to handle the issue. What are your roles and responsibilities when the child is undergoing these type of symptoms or issues? At the same time, in this case, the treatment is given for depression. At the same time, they also do physical examination to know that is there any other issues. And dear friends, remember one thing, you in this case and all, you cannot just go and come back. You need constant session with the counselor, constant session with doctors, so that what happens is that you can really help your child to come out from the problem. And that is why such type of cases you need proper follow-up. So these are my references. Especially, I have referred the School Phobia book. It is in Kannada, written by Dr. P.V. Bandari. And there are other references which I referred for my case studies and to get a proper information. And dear friends, this is my channel. If at all you have not subscribed to my channel, please subscribe. Thank you.